set. Good evening, good afternoon, everyone, and I will immediately turn it over to our Chief Medical Officer, Dr. Janice Fizgerald, for our daily update.
Thank you, Premier. Good afternoon, everyone. Thank you for joining us today. Since our last media availability, we have no new positive cases in the province. Total number of cases remains at 258. By region, we have 240 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. 52% of cases are female and 48% are male. By age, we have 22 people under the age of 20, 38 between 20 and 39, 38 between 40 and 49, 56 between 50 and 59, 57 between 60 and 69, and 47 who are 70 and above. 4 people are in hospital due to the virus, and of these patients, 2 are in intensive care. 225 people have now recovered, and in total, we have tested 8,220 people. Together, we have weathered the first wave of COVID-19 in our province. This is good news, but it is important to remember that this virus still has the potential to be a serious health threat to the people of this province until a vaccine becomes available. As this is not likely to occur for many months, we have to find a way now to live with COVID-19 in our communities. While we will be looking in the near future to relax some of the public health measures in place, life as we knew it will not resume for some time. That is not to say we can't regain some of the freedoms that we've temporarily lost due to COVID-19. Rather, as we move forward, we will have to do so slowly, with caution and care. As long as COVID-19 is active in the world, surges of new cases are possible. To mitigate the risk, we must remain vigilant by following any public health measures that remain in place for the long term. We know it will be important to continue to take the precautions that have worked well for us up to now. This includes frequent hand washing, staying home when you're sick, covering coughs and sneezes, and continuing to practice physical distancing. When we do begin to lift some public health measures, it will require our continued patience and determination, as we have already seen second waves of this virus in other countries around the world. We know that the stakes are high, and it is more important to do this right than to do it quickly. As I mentioned during a media briefing last week, as we look to ease up on some of the public health orders in place, we will have to implement some new orders to help support our actions moving forward. In this regard, today I'm issuing 2 new orders. Yesterday, I issued an order regarding long-term care facilities and personal care homes. Today, I am issuing an order relating to assisted living facilities that provide care and assistance to seniors in their daily living. This is to ensure that we protect our most vulnerable populations before we begin to lift any public health measures that are in place. Effective immediately, these facilities will have to implement measures that will protect their residents and prevent the spread of COVID-19 in their facilities. This order is made out of an abundance of caution and not because we have received any complaint about these facilities. The second public health order is an amendment to a previous order related to individuals arriving in Newfoundland and Labrador from outside of the province. Effective May 4th, 2020, all individuals with the exception of the following will be prohibited from entering our province. So the exceptions are individuals whose primary place of residence is Newfoundland and Labrador, asymptomatic workers and individuals who are subject to the updated exemption order effective April 22nd, 2020, and individuals who have been permitted entry to the province in extenuating circumstances as approved in advance by the Chief Medical Officer of Health. These measures are necessary to further protect the health and safety of Newfoundlanders and Labradorians as we navigate the next phase of living with COVID-19. For more information on these orders, please visit gov.nl.ca/COVID-19. As a recap, for those who may just have joined us, we have no new cases since yesterday's media briefing, and the total number of cases in the province remains at 258. We have 240 cases in Eastern Health, 8 in Central Health, 4 in Western Health, and 6 in Labrador-Grenville Health. Thanks to our collective efforts, we are at a turning point with COVID-19 in our province. How we move forward will depend on each of us and will require the same stamina, drive, and determination that has gotten us this far. As it has been said many times before, COVID-19 is a marathon, not a sprint. And though it may take us a while to get there, if we remain focused on our end goal, I am confident that we can and will reach the finish line together. Thank you.
Thank you, Dr. Fizgerald, and good afternoon, everyone. Well, another day with no new cases. That's, I think, what all of us would agree is a good day for our province. Seeing no new cases, as Dr. Fizgerald has already said, leaves us with a bit of hope, and as we start looking forward to a new way of life in Newfoundland and Labrador. The last 6 weeks, we all know, has been challenging for people in our province, and indeed all Canadians. Activities that we once took for granted. It could be simple things like spending time with family and friends on a weekend, little walks with families and friends, playing sports, even simple things like getting a haircut, going to the grocery store. Some of these things are just almost impossible to do today, and those that we can do look dramatically different. So I appreciate that people want to get back to a new normal, and they want to know what their future would hold. So as Premier of the province, I'm no different than you. As a grandfather and a father, I'm looking forward to our new future as well. But as life that we knew it, it will change, and our future will look different. As a province, we have rallied together to follow and support Dr. Fizgerald's very thoughtful public health policies to prevent the spread of COVID-19. She's put in place a number of special orders, 2 new ones again today. She's put those in place through a state of emergency, which is a public health state of emergency, and that's been in place since March the 18th of 2020. We all know that we have to respect this virus. We've seen different areas around the world. We've seen this virus spread like a wildfire. It has no boundaries, and we know it can take lives. Our plan going forward is to respect that the threat is still at our doorstep and that we have to live with COVID-19 in our communities until a vaccine is found, and that's one that is approved. That can be, as was just mentioned, many months away. I know we've asked a lot of you, and we want to thank you for following the guidelines. But rest assured that every decision that we've made is solely your best interest for your health and your safety. As we said yesterday, Dr. Fizgerald and her team has been working extremely hard on a plan. We support her, and we support her team's work. Tomorrow, you will see how we introduce slight changes in the way we live in Newfoundland and Labrador. It will be a cautious approach. It will be evidence-based. What this comes down to is laying the foundation of how we live with COVID-19. Our plan will balance the risk of businesses with the prevention of a resurgence. We've been taking the necessary time to do this right. We have been extremely cautious. We've asked you to be responsible and follow the guidelines, and we will be responsible and rolling out how the next phase is put in place. The last thing we want to do is compromise the progress that we've been making or threaten the health of your families, your friends, and your neighbors. So we look forward to sharing this information with you tomorrow. And as we will continue to do everything that we can to support you and your family during this tough time, there's been already a number of supports that's been put in place. And just recently, many of you would have known that the federal government announced supports for businesses whose work has been impacted by this pandemic. There's been many supports in place. Many of those have been cost shared with the provincial and the federal government. One example is the Canada Emergency Wage Subsidy. What this does is it provides employers with reimbursement for wages paid of up to some 75%. That's up to a maximum of $847 per week per employee. And earlier today, your provincial government released details of the provincial compensation available for the private sector employers that have had to self-isolate due to the COVID-19 travel restrictions. And these were the travelers had the restrictions that were put in place prior to their time of travel. This includes individuals who are self-employed. The provincial government is providing a maximum of $500 per week for each employee under the provincial program. So the federal funding up to a maximum of $847 will now be topped up to a maximum of $1,000 per week. As you know, not everyone will qualify for the $847 per week under the federal program, so it's important that the provincial government would step up and take that maximum to $1,000 per week. Because we know that the stress of this global pandemic is having on your businesses and on your employees, and also those that we require to self-isolate. Our priority on the outset was to ensure that nobody had to choose between protecting public health and getting paid. This program will take employers a step closer to easing some of the burden that they and their staff have faced. You can find the latest information on this at our COVID-19 website. Just click on the latest news and actions from government.nl. We also understand that the challenges that businesses are faced in Newfoundland and Labrador are somewhat unprecedented. Our business community has brought forward significant recommendations for how we can assist them in dealing with this pandemic. Swift action is required to help businesses now and to assist them in transitioning to what is a new normal. To ensure that we make quick and informed decisions, we've engaged a man by the name of Mr. Paul Mills, and he is already developing a range of initiatives to support the provincial economy. That work has already begun. For those of you that would know him, he's a seasoned executive with some 35 years of experience in economic development and public administration. Served over 20 years as vice president of ACOA, Newfoundland and Labrador, and has extensive networks across Newfoundland and Labrador, and indeed across the country. Mr. Mills has been working with a group of ministers, with government officials, industry leaders, academia, and for the organizations throughout our province. And this will inform government on our decision-making process. So this will be an extensive engagement led by Mr. Mills. We'll take every opportunity to mitigate and respond to the needs of our businesses and economic sectors. We will find, no matter how big or how small. So this level of engagement is to get the information on how we fill the gaps and help you be successful coming out of the health crisis, going into the health crisis that will face Newfoundland and Labrador. So we will take concrete actions, and they will be implemented. And we will be quick, nimble, and flexible, and learn on our approach and lean on our approach. Now, if we switch gears for a moment, there's been a lot of discussion over the past few days about tourists entering our province. Dr. Fizgerald has put in some strict public health measures. They've been in place for over 6 weeks now, which includes measures for traveling into and within our province. Right now, we have such things as mandatory declaration forms, self-isolation plans, and we have inspectors in place at all our borders. On Tuesday, as an example, when you think of the numbers, and we often wonder about how many people are actually coming into our province. Well, if you look at the latest numbers, which were yesterday, some 144 people arrived in the province. That could have been through the airports, through land or sea. That's one day, 144 people. So these are essential people that have been traveling to and from work at every single entrance point in Newfoundland and Labrador. Now, if you break that down a bit further, it was just 82 people that would have arrived for the full day in St. John's Airport, 5 at the Port of Bass Ferry, and that was excluding the commercial transport trucks. 25 from the southern Labrador-Quebec border, and all of those people were exempt. 36 from the Labrador West to the Quebec border as well, and 7 into Walbush. So you can see for a province the size of ours, these numbers are not extremely high at all. So it is important that everyone must be compliant with and follow the health guidelines once they arrive into Newfoundland and Labrador. And we also know that people are traveling must do so in a responsible manner, only if it's essential, and being truthful about the reasons why you're in Newfoundland and Labrador. So folks, no more loopholes. Our health is just too important. So with that, I look forward to tomorrow's briefing as we look forward what life will be like living with COVID-19. We know that this virus moves swiftly, but it only moves when you move. So a virus anywhere is a virus everywhere. So I'll now pass it over to Minister Haggie for a few comments.
Thank you very much, Premier. And again, congratulations to everybody on another day with zero. It's hard to hold the line, and you've done a grand job. Given some of the correspondence I receive, I think there's been some lack of clarity about how our new act worked. When it was crafted and passed through the House less than 2 years ago now, it was a state-of-the-art bill. And in it were measures designed to deal with outbreaks, epidemics, and pandemics. And what happens under that is the authority exists for the minister on the advice of experts to declare a provincial state of emergency on the grounds of a health issue. When that happens, the authority to make orders and exemptions to orders and all the kind of changes that you've seen evolve, sometimes very rapidly over the last 6 weeks, actually rests with one named individual, and that is the Chief Medical Officer of Health. It is not any longer a decision for the elected politicians or cabinet in that sense. It struck me as an analogy. I used to work in Liverpool, which is a big port on the west coast of the UK, and when large vessels would come into harbour, the captain would relinquish control of the vessel to the harbour pilot, who knew the shoals and knew how to get a big vessel into a dock safely. And I think on this occasion, we have handed over the control of our vessel to our harbour pilot, and that's Dr. Fizgerald. And I have to say, she's done an excellent job in doing it. But I think it's important to state that there, because I think some people in the media and in social media have had the impression that somehow there were dark political agendas being followed behind the scenes. And I really want to assure everybody that that is not the case. This is solely about the health and well-being of Newfoundlanders and Labradorians. There has been confusion about the orders, and I think part of that can only be down to the fact some of these have changed frequently. And they've needed to, because this virus is sneaky. It changes and we have to adapt to it. The latest in orders and exemptions to those orders can be found on our COVID-19 website under the tab Public Health Orders. And because of correspondence, I'm going to address the issue of exemptions because there seems to be some confusion. But if you look at the exemptions list published on the 22nd of April, there are 7 points, and they're actually really crystal clear. Even though they're written in semi-legalese or legal kind of language, even I can understand them. And the first one talks about asymptomatic workers in trade and mining. And it essentially says that you are exempted for the purposes of travel home and travel to work, and the rest of the time you are required to self-isolate. The next paragraph references workers who work in other provinces. They are exempt whilst travelling to and from work, and the rest of the time they must self-isolate. It references healthcare workers who might have to leave the province for a period as part of their duties. They are exempt while at work and while travelling to and from work. The rest of the time, they are required to self-isolate. Workers who are important to the critical infrastructure of the province are exempt while travelling and working only, and the rest of the time they are required to self-isolate. You get the drift. You have to self-isolate unless the work you are actually doing at that moment is important under the exemption order. No exceptions. Yesterday we had a flurry of inquiries around appearance of possible tourists in part of the province, and Dr. Fizgerald's amendments and changes to the orders, I think, have sealed that loophole for good. The regulations are very clear. Those issues have been reported to the appropriate law enforcement agency. And whilst I understand people's concerns, I cannot address, and nor is it appropriate to address, issues of enforcement as a politician. They are in the jurisdiction of either the RCMP or the Royal Newfoundland Constabulary. They are the experts at enforcement. That is their role, and they will deal with it in the way they see fit from their experience. They both have teams dedicated to this particular issue. The Premier has mentioned, tomorrow there will be an unveiling of a plan. This is a public health approach. It's health in all policies. It's health in all elements of government. It will be slow and it will require discipline. It will require the same discipline that we and everybody in this province has obviously shown to get us to where we are now. This is to adapt to the presence of COVID. It is a feature of our lives and will be for some considerable time. It will allow for progress to be made in terms of adaptation and doing more, but it also will allow for slippage in the event that we see a second wave. We don't have a vaccine against this virus. We don't have a specific cure for this virus. And at this point, we're not even sure whether the second wave will be COVID-19 or COVID-20. So until that time, the foundations of whatever we do for the foreseeable months has to be physical distancing. The virus only moves when you do. The virus needs you to survive, it needs you to reproduce, and it needs you to spread. So again, make a bubble, stay in it, and don't burst anybody else's. Thank you very much, Premier.
Thank you, Minister. I think the Minister did a great job explaining the role of our Chief Medical Officer and used the analogy of a harbor pilot. Well, we know that pilots are protecting passengers and they're protecting the cargo on those large vessels. And I think that, accurately describes the role of the Chief Medical Officer in our province. So I now turn it over to the media for some questions for today.
Thank you, Premier. For the benefit of our speakers, we have 6 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. I will call on each reporter by name to ask questions, so please do not press star 1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and further questions can be emailed. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Janice Fizgerald, you spoke today about the new order that's coming into effect, or the amendment to one, on May 4th. What does this mean for those tourists that are currently here? We're hearing about them in Bona Vista and along our coast.
So the order currently in place that everybody has to self-isolate is still there. So it means that those tourists will need to self-isolate for 14 days, as we have previously said. The order will come into effect May 4th, so it will be going forward from that date.
Great, thank you. And I'm also wondering, Minister Haggie, if you, and you might not have these numbers in front of you, but in terms of the elective surgeries that have been put on hold, do we have an approximation of how many have been put on hold because of the pandemic?
No, I can certainly get that number for you, but that would be something I wouldn't have to hand at the moment. We'll find it for you.
Thank you. Also hearing concerns from those that work within group homes having to work from different homes to different homes. We've seen the orders come in about long-term care homes. Are we going to see something similar for group home work?
My understanding is that they are effectively covered. We're certainly working with the home support area to try and deal with their requirements. Home support and group homes do constitute an area where there are often multiple workers involved with multiple clients. And some of it is actually very granular in terms of how you would deal with that. We recognize it's a challenge, and certainly the RHAs, the regional health authorities, are working with those individual group homes, those individual clients, and the home support agencies to try and get them moved towards minimal amount of interchange of staff.
Thank you.
Kellyanne, did you have a follow-up question?
Oh, sorry. Yes, I'm wondering about if we're going to be updating our symptom list, knowing that there's more symptoms being released, hearing about the calluses on feet, for example, and the loss of taste and smell?
So we'll update our symptom list as we need to. So what we're looking for when we're using our symptom list to decide who needs to be tested, right now we're looking for mild disease. So we want to make sure that we're catching as many people as possible. If the Public Health Agency of Canada recommends and sees that these symptoms are frequent enough to warrant being included in that symptom list, then that's something certainly that we will reconsider at that time. But while we hear reports of these symptoms, sometimes they don't happen. They're different enough, I guess, that they come to people's attention, but they don't necessarily happen at a frequency that will be useful for screening people in or out for the testing. So we have to be cautious about that.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. New Brunswick's plan that announced recently, it'll allow households to merge bubbles in phase one. Is that something they would consider it to make childcare more readily for working parents?
So we'll be releasing the details of our plan tomorrow, as the Premier said, and certainly all of these options are things that we have looked at. So, I'll say stay tuned for details tomorrow.
Okay. Parents and teachers. Hello.
Hello. Yes, Peter.
Sorry. Parents and teachers have been telling us. Many of them have saying that reminders, when virtual learning takes place, there's always a reminder that it's optional, and that's basically killed the incentive for a lot of people, either the kids or the teachers or parents. Was that the best approach to take in hindsight?
Well, so we work closely with the English School District and with the NLTA on this approach, realizing that we've never had to do this before in the province. So we put out the progress report on April the 22nd. This would basically, lay put a mark in place based on the work that had been done throughout that year. And so with this mark in place, we established and gave students the opportunity that they could increase that mark. So it was a bit of a challenge. If you weren't satisfied with this, work closely with your teachers, and you could improve that mark. So was this the right approach or not? I mean, I guess time will tell. But we did so with working very closely with the NLTA and with the English School District and with the Francophone School District as well. So, hopefully students will take the opportunity to actually improve those marks, especially those that are graduating this year and some of those that will be going into their last year of high school next year. Gives them an opportunity to get off to a good start.
Okay. And I just have one follow-up of a question that's constantly being asked. It's really hard to know what to say to someone, but the police obviously can't respond regularly to reports of large gatherings, whether it be next door in a cabin or on a street. So what do you tell people who, are worried about their neighbors flouting health orders? Might not even know their name, so they can't fill out a form.
I think the form is as broadly based as it's possible to make. I think at the end of the day, enforcement activities and questions about how that should be done should really be addressed to the enforcement agencies themselves. The challenge is that 911 is not an appropriate number to use for this. 911 is for life and limb-threatening emergencies or fears of immediate, danger or public safety. And the RNC and the RCMP have asked that number be reserved for that. I'm quite happy to go back and see if the COVID teams through either law enforcement agency would like to have another mechanism for referral. But on the basis of discussions as recently as a couple of days ago, they were comfortable with the process that we had in place.
Thank you.
Our next questions are from Ben Murphy of VOCM News. Please go ahead.
Dr. Fizgerald, I know you laid out those 2 new orders today for those entering the province, but just wondering what government is doing to crack down on screening people entering the province via Marine Atlantic and how that can be improved to really identify these visitors trying to come as tourists.
I think the operationalization of these orders is another issue. Certainly, we will be writing to the VPs of operations for Marine Atlantic, for the airlines that come into the province, and also to the Canadian Border Services Agency, who've offered their services as a liaison with commercial carriers in general to the province. The challenge really is that our jurisdiction only begins at Port aux Basques or at the airport. And what we would like to try and avoid is the situation whereby people who may be booking a ticket and boarding in Ontario under their requirements finds themselves in St. John's or Port aux Basques subject to our requirements and basically is in limbo. Because then my understanding would be that would possibly devolve onto the carrier. So we need a little bit of time to get that sorted out. And I think once that order becomes effective, it will become glaringly apparent to anybody who is in a position of booking people onto ferries or planes that there is an issue before these people actually leave their point of origin and set foot in the province. And I think that will go a long way to dealing with our operational concerns here.
And Premier, I just wanted to jump back to schools there for a minute to follow up on Peter's question. But I'm hearing from some parents who say their children are receiving very little face-to-face interaction with their teachers. And some say it was just last week that they received a Google form about internet and device access. What do you say to these parents who feel like their kids are getting the short end of the stick?
Yeah, so, we've heard some stories about this as well, also, Ben. It's, what I'm asking for parents and for students who feel that there's more support that's required. I mean, keep in mind, we have teachers out there, the teachers that were supporting them when they were in the classroom. Those teachers are still being paid, still working. And so right now, they're working to actually support the very students that they had in the classrooms, prior to the decision that was made to close schools. So we ask you to reach out to your principals. If there's something that we need to put in place as a government, get the information to those students. If there's a gap there that we can successfully fill, well, we're prepared to do that as well. But is reach out to your principals. Those teachers are in place right now to support the students for the remainder of this school year.
Okay, great, thank you. And Premier, I was also just looking for an update on policies and procedures around what's happening at HMP and other correctional facilities around the province.
I don't have that information for you right now in terms of changes that would have been in place. I can get that information for you through, Justice and Public Safety. It's not something that I've heard much about in terms of, questions that have reached me, but it's something that I can get the information for you. Of course, we want to make sure.
Great. Thank you.
We can do that.
Our next questions are from Peter Cowan of CBC News. Please go ahead. Peter, if you would press star 1 to open your line. I think we have some technical issues there again today for Peter. We'll go next to Patrick Butler of Radio Canada. Please go ahead.
Hello. So the number of cases is low in this province. We keep hearing about we're keeping things closed here, while in places like Montreal, we're seeing more than 400 cases per day. And while that province is actually moving toward reopening its economy, clearly we're being really careful here in Newfoundland and Labrador. But when you look at the situation in Quebec and how different things are there, is that province headed for a particularly dangerous situation, given they haven't, waited for things, or they're not in a situation as we are here?
The decisions that we make, here in our province, working with the Chief Medical Officer, we make those, thinking about Newfoundlanders and Labradorians. I think, when you listen to the national dialogue and conversations that are occurring the Prime Minister has made it quite clear, as you make changes and relax some of the measures that's been put in place, it's the responsibility of the provincial governments and it's their jurisdictions. That is one of the reasons why we haven't seen an Emergency Measures Act put in place by the federal government. They have left that to the provincial jurisdictions and the territorial jurisdictions. So the measures that we put in place, working with the Chief Medical Officer here, is based on the interests of Newfoundlanders and Labradorians. Our job is to make sure, working with on the advice of the public health officials, is to make sure that we protect the short term, the midterm, the long term of health for Newfoundlanders and Labradorians. So that's our decision-making process, and we've been effective and made some good, sound decisions so far, and we've seen some good results of that. But we must make sure that we remain cautious in relaxation of those measures. All of this goes to the work of the public health officials.
You've also said that we're sort of headed into unknown territory as we think about reopening the province. In Quebec, just to use the example of Quebec again, the premier of that province, François Legault, said yesterday that the province will reopen the economy and that he's going to see what the effects will have on contagion in the province. Given it takes time for incubation to occur, how can we effectively gauge whether lifting measures is safe? And is it fair to say that this is all kind of a big experiment?
Well, I think there's a lot of unknowns, and when you look at what's happening right across the country right now, you look at BC, one of the early provinces that would have been impacted by this and still going through it to a lesser degree. We've seen Alberta, where we've seen some recent flare-ups, as you know. We look at Saskatchewan, and they've put their 5-point plan in place, and with a very cautious approach. Manitoba in a very similar situation. Ontario's taken the approach that we're going to let you know when we're ready to implement the measures. And Quebec, I guess you would argue, that have made some of the most aggressive approaches. New Brunswick has taken a very cautious, softer approach as well. Nova Scotia is still, working through the details impacting their province. PEI released their plan yesterday. And, we'll be releasing our plan tomorrow. So I think every single province is taking a very different approach, each of one concerned about the health of their own, the residents that live there. So, for us, we think, the plan that will be announced tomorrow as we get a chance to review it will be to the benefit and to the health, and hopefully that businesses will be able to then, through risk assessments, find ways, either creatively or otherwise, get themselves back into business in a marginal way. And as a provincial government and a federal government, it's our job then to support them, to fill in the gaps, to make sure that they remain successful.
And if I can add, Premier,
yeah, please.
I don't want people to think that this is a big experiment, that it isn't. We have taken the evidence that's out there, that's good evidence, and we have developed policies. We have talked about this on a federal, provincial, territorial level, and we have all agreed to the basic approach that is based in sound scientific evidence. And that may look different in each province, but the approach is based in the same principles.
Dr. Joe, could you, I'm just wondering about, how we gauge the effectiveness or the safety of reopening or taking away certain restrictions. What are the things you're going to be looking for to be able to gauge that?
So we'll go into that in more detail tomorrow, but we do have a set of criteria and a set of indicators that we will be following very closely to see what is happening as we lift certain measures, and that information we'll use to determine if we can proceed and lift further measures, or if we have to stay at a level where we are, or if indeed we have to impose some of those measures that we lifted previously, impose them again. So we have a very well-defined set of indicators for that. So we'll go into that in more detail tomorrow.
Thank you.
We're going to go back to Peter Cowan of CBC News. Operator, if there's an issue with his line, could you manually open it for us, please? So Peter, press *1 and please go ahead.
Can everyone hear me?
Yes.
Peter?
Yes, we can. Go ahead.
Okay, great. Question about the new order. Why is it only coming into effect on May 4th? That's 5 days from now. And are you concerned that some people may use that as a loophole to try and get in before the restrictions tight?
From our point of view, Peter, I think I referenced some of that earlier on. There is a coordination piece here to prevent a situation whereby you have people getting on a ferry or on a flight and not being literally able to get out of the airport or the ferry terminal at the other end. I think that is that's a reasonable thing to do. It's a sensible thing to do. The issue currently is around people who really haven't grasped the concept of non-essential travel and seem to think that it's a nice safe place to come and vacation because our case numbers are so low. Forgetting the fact that they are required at point of entry to identify a self-isolation plan and also to submit contact details. So I can't speak to the individuals who would choose to do this. All I can say is that there is a lag before midnight on the 3rd or whenever it is this comes into force, whereby we can do some preparatory work to avoid having staff at Marine Atlantic deal with people who would be forever adrift on the blue puttees if we don't get it sorted out first.
Dr. Fizgerald, you are going to obviously have some discretion, and there will be lots of people who fall into some gray areas where they may have legitimate needs to come to the province but may not meet that criteria. Under what sort of conditions will you be giving out those exemptions?
So I guess they'll be quite individualized, but our thoughts went to people who have family members with significant health emergencies, or if people had to provide care that would result in significant distress to somebody from a health point of view. We were thinking of people near end of life, those sorts of things. Certainly we would want to be compassionate with regard to that, bearing in mind that there will be still some limitations with regard to self-isolation and things like that. But I guess, we won't know until the time comes and we have to deal with some of those exceptional circumstances.
Premier, you mentioned some of the numbers about how few people are actually coming into the province. In light of the fact that those numbers have reduced significantly, why is this measure necessary?
It's necessary to make sure we maintain the discipline. One of the things that I think one of the critical things that you have to do is you start making some changes and relaxing some of the special orders that's been put in place, is make sure that your borders are as tight as possible. Make sure that if you have to respond to an acute care issue, therefore, hospitalization and so on, that you have adequate supplies of PPE and so I think tight borders is something that the people of this province has been expecting us. This really shows, the reason why I put those numbers out today, it really shows that how tight those borders are today and how few people are traveling to Newfoundland and Labrador. And it's important, if we want to make sure that we control the spread of COVID-19, that we continue to do that, because we know that traveling and travelers from outside of Newfoundland and Labrador can be a major component and have an impact on the spread of COVID-19.
Thank you.
Our next questions are from Courtney Zwicker of All Newfoundland Labrador. Please go ahead.
Are regarding the hiring of Paul Mills. I'm wondering, how was he selected for this work?
Well, Mr. Mills has considerable experience within Newfoundland and Labrador for decades right now, given his work with ACOA and giving his networking, and he's been around and worked with Memorial University, worked with the oil and gas industry. There's not too many businesses within Newfoundland and Labrador that would have had to work with Mr. Mills, would not understand the impact that he can have. So he's got great networking skills available right now. So he'll be working with the key departments within government, and there will be engagement through those departments with our business community and associations in Newfoundland and Labrador. What was important here is that we be able to get measures in place rather swiftly. Because when you think about the federal programs that are in place right now, we can count on most of them till around the middle of June. And we want to make sure that from the provincial government that we're in a position to be able to step up and fill those gaps. And if you look at just the tourism, hospitality, Newfoundland and Labrador is a good example. We know already this will be a difficult year for that industry. So what measures can we do to support them, making sure that they come out of this as strong as possible. We want to promote, as an example, staying in Newfoundland and Labrador, traveling within Newfoundland and Labrador, if at all possible, that you stay with your own communities in Newfoundland and Labrador, would spend more time here in our province based on the impact that traveling could have, on those industries. So it's all those sorts of things and many others, but we must make sure now we use the expertise of Mr. Mills working with those industries so that we can do our part as a provincial government.
Okay. Was he selected through like a tender process, or was he sort of handpicked for the job?
No, he's someone that's well known, so he'll be working closely with us now and providing that liaison work between the departments. This is something that he's done before, and all that information can be publicly released, of course. But right now we needed to make sure that we had someone in place with the experience to work and was well known within our province. So Mr. Mills was one of the obvious choices for us.
Oh, okay. And are you able to say what the province is paying for his work?
I can get that information for you. It's a contract that's put in place, but absolutely, we can get that to you.
Thank you.
We have about 12 minutes left for questions, so I'm going to take some single questions, starting with Kellyanne Roberts of NTV News. Please go ahead.
Back to the amendment that's going to be happening for May 4th with travelers. So for those who attempt to travel to the province but don't fall under any of the categories, are they going to be told to turn around and go home? Or how specifically is this going to work to prevent people who don't need to be here from coming here?
That's part of the operational piece I referenced earlier. At the moment, the only mechanism would be greeting them in St. John's or Port aux Basques and saying turn around and go back again, which would create, I'm sure, some trouble for the airline or the ferry. My understanding, based on what happens in other jurisdictions, is that they would be declined a seat or a ticket for their ferry at the point where they either purchase it or where they turn up at the dockside in North Sydney or the airport in Toronto. And then that would be the end of the matter as far as we're concerned.
Thank you.
Our next question is from Peter Jackson of The Telegram. Please go ahead.
Sorry. You mentioned that you have Paul Mills working with various stakeholders. What do you feel about the idea of setting up an economic recovery task force, as suggested by Trades NL and the Construction Labour Relations Association?
Well, what we wanted is something here someone that could be in a group that could respond quickly. There's already a lot of work that's been done in terms of the analysis of some of the work, that would be required for various businesses. So, putting in place a big, complicated, complex, group that would, that would have limited time, the ability to be the time of nimbleness and flexibility that's required to get those ideas back. This was what was important for us, to be able to move quickly and sometimes having a large, a large board or a large group of people, can actually make things slow. We know that. And so right now, the level of engagement we also felt would be much more or higher this way, as we could take this small group of people, get them out to the business community, get them out to, people like, Trades NL, as you've just mentioned, and other associations that, create employment in Newfoundland and Labrador. So we know that those businesses create jobs. We know that those, unions would have examples and good ideas as well, as would many of our community organizations. So swiftly get out there, get those ideas back, and see what role the provincial government can play based on the information that we gather.
Thank you.
Our next question is from Ben Murphy of VOCM News. Please go ahead.
Thanks. I just wanted to ask a follow-up just further to Peter's question there, and correct me if I'm wrong, but why has government not established a cabinet committee with deputy ministers, assistant deputy ministers, and officials to start this scenario and protocol for restarting industries like healthcare, service delivery weeks ago, rather than bring in Paul Mills, who is not in public service, when we're already paying these people to do this kind of work, rather than bringing someone else in and to pay them as well? Does that make sense?
Yeah, that group is already working. Matter of fact, that group met last night. I chair that group. That's our cabinet committee on jobs, so that work continues. And so that group is in place. That's a standing committee of cabinet. And on that committee, on that cabinet committee, would have people like, Minister Haggie, who do some valuable work in jobs and creating jobs representing Newfoundlanders and Labradorians. What was important here is that we have someone that can work and facilitate the work of this committee and all those deputy ministers and all those ministers. So someone who could be actually the gatekeeper of that information. And so you can actually collaborate and collate and bring that back together so that we can make the decisions that would be best that we can best make to stimulate the economy in Newfoundland and Labrador, keeping in mind that we had to do this based on a risk assessment, based on the information from the Chief Medical Officer. So we add that extra layer because we must make sure that we do so in a safe manner with the special orders that have been put in place by the Chief Medical Officer. So it makes it a little different and a little more complicated this time. But the ability here with someone like Mr. Mills working with that Cabinet Committee is to get the best ideas, because it's just as we mitigate the impact of COVID-19.
Thank you.
The next question is from Peter Cowan of CBC News. Please go ahead.
Question for Dr. Haggie and Dr. Fizgerald. Yesterday, you were talking about how there's 80 staff in the department dealing with the nuts and bolts, and it's difficult for them to change course quickly in the middle of dealing with everything that they have to. Considering that this pandemic is going to be here for the long term, do we need more staff in the department to increase our nimbleness?
It's a very good question. I think what we need to do is look after the staff we have and support them. And certainly from a sort of whole of government response, we've seen staff drafted in to provide support in the Department of Health, people who used to work in the department who'd moved on to, say, finance or TW were brought back in fairly speedily. In terms of public health in general, we have managed with a very lean core of public health professionals. And I think just like other jurisdictions in Canada, those staffing complements are going to be revisited over the course of the next months and probably the next years.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
Representative for Marine Atlantic earlier this afternoon. And they said that, Nova Scotia has had physical government representatives on the scene in North Sydney meeting with people as they get off the boat since March. In this province, according to this person, it's only been happening since last week. And before then, Marine Atlantic was collecting, these forms that people were filling out, but not evaluating them or anything, because that's not their job before these people were going into the province. Why did it take so long to do what Nova Scotia was doing since March in this province?
I think you'll find that what happened is the situation evolved over a period of time. Originally, we had, and still do, have a great relationship with Marine Atlantic, and they offered this service. They ran it, and we had staff from Western Health at the other end. Then it became apparent that that wasn't working as well as it could. We looked at other options. Ultimately, we have moved through various iterations of either RCMP or FLR officers and these kind of things. And each time we have found that people still are inventive enough to try and find loopholes and ways through it, which is a testament to human ingenuity, if not intelligence. But quite frankly, we've kind of assumed that people would be sensible about this and see what the obvious intent of these orders was. But we have had, over the course of the time of this pandemic, to become more and more restrictive to deal with people who have a slightly different view of the world than we do. So we are where we are now. It will change again come May the 4th. And indeed, the need for those kind of enforcement activities will alter, bearing in mind if the system works, then there won't be anyone who will need enforcement at the Port of Basken, for example, of the ferry, nor indeed at the airport in St. John's. But we've got to get there first.
Our next question is from Courtney Zwicker of All Newfoundland Labrador. Please go ahead. Courtney, if you would press *1, please.
I'm sorry to interrupt. That line has disconnected.
Thank you very much. The time for questions has ended for today. We invite you to join us again tomorrow at 2 p.m. at 1:30 in most of Labrador. Thank you and have a great evening.